It's my pleasure to introduce this plenary panel that spotlights federal strategies in accelerating work in the field and across early care and education centers. I'm going to introduce the speakers briefly. They're in order here. So immediately to my right is Cindy Long, who is currently the Deputy Administrator of Child Nutrition Programs of the Food and Nutrition Service at USDA. Steve Hicks is to her right, and he serves as a Senior Policy Advisor in the Office of Early Learning at the U.S. Department of Education. To his right is Captain Meredith Reynolds, who leads the Early Care and Education team in the Obesity Prevention and Control Branch of the Division of Nutrition, Physical Activity, and Obesity at the CDC. Rachel Schumacher is to her right, and she is the Director of the Office of Child Care, where she's committed to increasing access to quality child care that promotes early learning and the development of children from birth to school age in partnership with their families and communities. And at the very end of the table is Barbara Thompson, who is the Director of the Office of Family Readiness Policy at the Department of Defense, where she's responsible for programs and policies that promote military families' well-being, readiness, and quality of life. So in advance, thank you for the panel.
All right. Thank you, Bill, and thank you all for the opportunity to be here. I'm here today representing USDA and the child nutrition programs, and specifically for today's topic, I'm going to focus on our child and adult care food program. I would like to just touch briefly on just some basics of what the program is, and then spend just a couple minutes talking about some of our key initiatives and activities around the area of nutrition standards and nutrition environments, and then close with just a couple of comments on where we are going with the dietary guidelines for Americans. So to start with just the basic programs, and I know many of you know this, but for those of you who don't, CACFP, the Child and Adult Care Food Program, is a federal program that provides resources to support nutritious meals in child care settings. And that includes service to children up to 12 in child care centers and homes, as well as some sort of special aspects for serving children up to age 18 in specific at-risk after-school programs, as well as programs that operate in emergency shelters. We are currently serving around 3.3 million children per day in about 180,000 outlets. And so it is a program with some substantial reach, which does give us the opportunity we hope to have some positive impacts around the nutrition and the wellness environment in our CACFP-operated homes and centers. At the moment, our major focus at USDA and CACFP, as well as all the other child nutrition programs, is implementing some very important changes that were made to the programs in the Healthy Hunger Free Kids Act of 2010. That act directed us to update CACFP meal patterns. They haven't been updated in decades. I'm not sure how many years. And again, just for those of you who aren't familiar with the program, we do any meals reimbursed with our federal funds do need to meet certain standards in terms of what the meal contains. We did issue a proposed rule and develop those recommendations based on input from the IOM and based on the 2010 dietary guidelines, which were the current dietary guidelines at the time the rule was proposed. I don't have time to go into great detail about what the proposed rule contains, but as this slide indicates, there's some updates in the infant meal patterns to make them current with recommendations from the pediatric community and with current science. And then in terms of the pattern for the older children and adults, we really did focus on bringing them up to date with the dietary guidelines, including things like a greater focus on fruits and vegetables, treating those two as separate components, an emphasis on whole grain rich products, some reduction in the disallowing grain-based desserts, and then some things that deal with meal preparation, specifically prohibiting on-site frying. And then we have a number of areas in which we're seeking public input on our proposal, including issues around flavored milk and sugar in yogurts. I will also mention that the proposed rule includes not only requirements but a series of best practices, because the actual required elements of the meal pattern were designed to be cost neutral, because we know that there are not additional funds available to support improvements, but we did want to provide some guidance and support for those folks that do want to go over and above the required standards. There is more information about the proposed rule on our webpage. The rule was proposed back a little over a year ago in January of 2015. We are very hopeful that the final rule will be published very soon. I find myself saying that a lot in forums like this, but at this time, it's actually, I think a message you can take stock in. We are actively planning for implementation of the rule when it does become final and in place. We will be doing many webinars. We'll be providing online modules. We'll be doing in-person trainings in partnership with our state agencies, who of course operate the program. So we do look forward to those things, and I do want to emphasize that we very much like to work with our partners in getting information out. So in terms of things like webinars and such, we would be happy to work with any of our national or state level partners to get information about the rule when it comes out. We have many resources and initiatives around the area of nutrition. I did want to emphasize that another thing that the Healthy Hunger Free Kid Act did was direct USDA not only to improve and modernize the nutrition standards, but it also, for the first time, gave us a mandate to consider not only the food, but also the environment. So we specifically were directed to look at issues around physical activity and electronic media, and we do have the resource that you see up on your screen available for that. I want to just quickly plug our other resources. I always like to say that I think our team nutrition resources are one of USDA's best kept secrets, and I would like to change that. We do have a number of resources that are focused on the child care community. These are just some examples of actually some things that we'll be updating, some wonderful recipes, some great resources that teach kids around sort of farm to school issues, where food comes from, how to bring concepts of gardening and things like that into the early childhood environment. And lastly, boy, that 7 minutes, it's going fast. I just wanted to briefly touch on another sort of exciting development that will actually involve our sister agency, the Center for Nutrition Policy and Promotion, as well as the Office of Disease Prevention and Health Promotion at the Department of Health and Human Services. Those two entities are responsible for the development of the dietary guidelines. Hopefully you're all aware that the 2015 dietary guidelines were issued in early February, but we are already planning for the next round of dietary guidelines, which are slated to come out in 2020. And one of the exciting things about the next go-round of the dietary guidelines is that we are anticipating that we will, for the first time, be able to provide guidance for the 0 to 24 months age group. So that is something that we are, again, actively engaged in, and something to look forward to over the next few years. So with that, I'm going to stop and turn it over to the next panelist. All right, thank you very much.